Hey guys, you are watching Fever FM, and this is me, RJ Sindhu. Here we are for a very important reason to spread awareness about something that's so important that I feel is, not given much of an importance in our country. Yes, we are going to talk about stroke. Stroke is a major global public health problem, and in fact, in India, stroke is increasingly becoming one of the reasons for premature disability and deaths. As per World Stroke Organization, one out of every four people has a chance to, suffer stroke in their lifetime. And that's not all. In our country, around 1.8 million people suffer from stroke. And the saddest part, a very few manage to reach hospital in time. That is some serious food for thought, right? And that's why we have invited our guest today, Dr. Satyanarayana Mandalapu. He is the consultant neuro and interventional radiologist, assistant professor, Department of Radiology. Thank you so much for joining us in this session, Dr. Satyanarayana. It's indeed a pleasure
Yeah.
to have you here with us. And doctor, tell us first of all, what is brain stroke and how severe is this disease really?
So brain requires blood supply
Mm,
for its nutrients and for its whenever the blood flow to the brain is stopped, then
mhm.
the blood cells die. That is
Okay,
called brain stroke. So
okay,
brain stroke is of two types.
okay.
One is stroke which due to blockage of blood vessel, and
Mhm.
one other is when there is a bleeding inside the brain. So
Okay,
these are the two types of stroke.
okay, okay. And how severe is this disease really, doctor?
So with each passing minute, about
Mhm.
2 million brain cells die.
Okay.
So 8 out of 10 people who suffer this disease become
Mhm.
bedbound, or he requires some persons for his daily activities
Correct.
and all to
Yes,
go.
yes, yes. So that is the severity of the disease. But, a lot of them don't even realize the symptoms of stroke. Doctor, can you tell us what the symptoms are and how to recognize if someone has it? See, when somebody is having a stroke, I think it's very important for people around to be aware. So if I know that somebody is having a stroke, I can help that person. Well, so that kind of awareness is required. So how to actually know the symptoms of stroke? How to identify them?
For the layperson or public person, so
Mm,
symptoms of stroke can be remembered as fast.
okay.
Fast means F stands for facial weakness.
Okay.
A, that is facial weakness or facial drop or facial deviation.
Okay.
And A for arm weakness, where
Okay.
there is dropping of the hand or weakness of the hand or weakness of leg.
All right.
And yes for speech difficulty. So
All
patient
right.
will not be able to speak out, or there will be not
Stuttering
clear
and
speech.
okay.
Yes, there will be no clear speech. And
Okay.
T for time to act. So you need to act fast.
Fast.
So
Correct.
and so that you to reach the hospital and then you to get a better care.
Absolutely. Look for fast and act fast. That's what's required
Uh,
during a stroke.
Other symptoms are loss of balance, and
Okay.
sometimes the patient presents with severe headache. These are the
Okay.
other
Other
symptoms
symptoms.
of stroke.
All right, doctor. But I think prevention is better than cure. So instead of looking for the symptoms and acting during that time, I think it's better to prevent stroke. Yeah, prevention is always better than cure. So what are the preventive measures that can be taken, doctor?
So actually, so many of the strokes can be preventable.
Okay.
Like patient, like we have to be healthy, take a diet which is a balanced diet and a healthy diet which
Okay.
contains a lot of vegetables, fruit. At least 40% should consist of fruits and vegetables.
Vegetables. All right.
And then we have to do physically fit, do around the walking or regular walking.
Okay.
And then we have to uh, these people should not smoke, and they should stop alcohol intake.
All
and
right.
then uh, and then there are other modifiable risk factors like diabetic control,
Okay.
controlling of our blood pressure and our
Okay.
lipids inside the body. When
All
these
right.
are kept under control by medication, the
Mm.
stroke can be preventable. In more than 80% of the strokes are
Preventable. Okay,
prevented.
that's fantastic. And doctor, what are the treatment options available for stroke?
Actually, there are two types of before they say only stroke can be not treated. It can only be
Correct.
by now the treatment options have come for stroke. Like
Okay.
there are two types of treatment depending upon the patient when he presents to the hospital and how
All right.
severe is the stroke.
All right.
So if the patient presents within 4.5 hours of stroke,
Hmm.
so a drug can be given, that is IVTPA. So
Okay.
that can be given over 1 hour, so that
Okay.
so that so that the block vessel can be open. And
All right.
in other patients who present beyond 4.5 hours or to
Okay.
within 24 hours, then if there is a major blood vessel occlusion,
Okay.
we have to do some CT scan or and then we have to see whether there is a large vessel occlusion or not. So if
All
there is
right.
a large vessel occlusion, mechanical thrombectomy can be done. So
All
in
right.
this mechanical thrombectomy, we pass a retriever into the occluded blood vessel, and this is placed across the occluded blood vessel, and then it is removed. When
All
it
right.
is removed, the clot also it will remove the clot from the occluded blood vessels.
All right.
By this method, even around 80% of the occluded vessels can be opened,
All
so
right.
that a disabling stroke can be prevented.
All right, that's interesting. And you are time and again talking about the time that the patient presents himself or herself at the hospital. Why is there so much discussion, or why is time so important when it comes to stroke, doctor?
Because of the large vessel occlusion or any other stroke, because
Uh-huh.
8 out of 10 patients, they will be disabled for life. Like
Okay,
they require some other person's requirement will be there to do
throughout their
his
life.
daily activities.
Correct,
So
correct.
that's why, and even around once a blood is clotted, when there is a
Mm.
stroke, about 2 million brain cells die.
Okay,
So
okay.
which is a huge number,
Number,
and
correct.
because of that, the patient will be uh, he will require all his for his daily activities. He requires other person's support to do his daily.
Correct, correct. So that can be prevented if you act fast. And that's a very interesting thought. Thank you, doctor. And also, there are reports, talking about COVID and the connection of stroke. Now, a lot of new studies saying COVID has started having after effects. It leaves its effect on the heart, on the lungs, and also there is a connection to stroke. So, tell us, does a COVID patient have a higher risk of stroke? Is that true?
Actually, as per various journals that have published, so yeah, there is about 7.6 times higher risk in these COVID patients.
Okay.
So the doctor should be seeing that whenever the patient comes with this stroke, they have to act fast and be
Okay.
fast, so that we can prevent the disability for these COVID patients.
All right, all right. So that is also another added thing. Doctor, thank you so much for joining us in this session. Your insights were great. I'm sure your words of wisdom and experienced medical advice will really help a lot of our viewers and our listeners. And let's be sure to remember all the health tips and practice them. Prioritize our health above all. Practicing a healthy lifestyle, eating a balanced diet is very, very important. And this stroke day, let's promise to take care of ourselves and the ones around us also. And remember to think about fast and act fast. Thank you so much, Dr. Satyanarayana, for joining us in this session. It was a great session. So much we learned. Thank you very much. And you
Thank you.
guys stay tuned to Fever FM. My name is RJ Sindhu. Remember, guys, prevention is better than cure.